Toothbrushes are classified into various types. Based on the hardness, it is soft, medium, hard, and extra soft. Based on the handle design, it is straight angle, contra angled, flexible handle, and easy grip ergonomic handle. Based on the head size, it is small head, large head, and medium head. Small head, it is recommended for children. Large heads are usually not recommended because it doesn't have greater access. Medium head are usually for adults.
Now the most effective oral hygiene aid used is dentifrices, available as paste, gel and powders. The main ingredient present in dentifrices are abrasives, fluorides, coloring and flavoring agents. Uses of dentifrices: effective mouth cleansing, freshen breath, prevent tooth decay and prevent plaque accumulation. Now how to use this dentifrices? For children, we should use a half pea size of paste, and for adult, we should use a full pea size of paste.
First of all, before starting, let me introduce what is interdental cleaning aids. These are plaque removal devices which are important because most of the bacteria accumulate in the interproximal areas. So it is very important to remove these and keep the interproximal areas clean. So what are the types of interdental cleaning aids? First is the dental floss. Next is the interdental brushes. Third one is the wooden tips, and other aids which generally include the gingival massage, oral irrigation devices, and the recent advancement also include powered flossing devices. So dental floss will be dealt later in detail. Now we'll see about the interdental brushes. Interdental brushes are cone-shaped or cylindrical brushes which are made up of bristles mounted on a handle. There are two types of brushes available. One is the single tufted brushes and another one is small conical brushes. Let's see how to use the interdental brushes. They are inserted interproximally and they are activated with short back and forth motions or strokes in between the teeth. Next we'll see about the wooden tips. Wooden tips are either with or without handle. The commercial name is TimUdent. These are placed in the interdental space in such a way that the base of the triangle rests on the gingiva and the sides are in contact with the proximal tooth surfaces. It is moved in and out of the embrasure, removing the soft deposits from the teeth, and mechanically it stimulates the papillary gingiva to grow. However, its usefulness is limited to the facial surfaces alone. So other aids which generally involve the gingival massage. The gingival massage is performed with either the toothbrush or the rubber tip stimulator or interdental cleaning devices. The oral irrigation devices are of several types. One can use water faucet to irrigate between and around the teeth. The water pressure is steady and it is controlled by turning the faucet handle. Other use the intermittent water jet. Lastly, the recent advancements which involve the powered flossing devices. The powered flossing devices contain a tip which is made up of nylon. They move more swiftly in between the teeth so that the devices are very sensitive to the gums, and efficacy is similar to that of manual flossing aids.
Brushing only removes the debris from front and back side of your tooth. If you have to remove the debris in between the tooth, you have to use a technique called flossing. Let's see how to do it. This is called a handled floss. Use front and back strokes as shown in the video to remove the debris.
Today I'll show you the correct technique of using dental floss. There are two methods of holding a floss: circle method or loop method, spool method. In the spool method, I take about 12 to 18 inches of floss and about 4 inches from each end is wound around middle finger of each hand. In both the hands, the last 3 fingers are folded and closed and both the hands are moved apart. In this way, about 1 to 2 inches of floss is held tightly between index finger of both the hands. Now gently guide the floss between teeth using back and forth motion. I curve the floss into a C shape against the tooth surface and move it up and down from gingival margin to contact point. After cleaning each tooth, I advance the floss by winding the used portion onto one middle finger and unwinding a fresh section from other finger. Continue this systematically around the arch until all interdental areas are cleaned. In circle or loop method, a loop or circle of the floss of about 12 to 18 inches is taken and both ends are tied securely with 3 knots. All the fingers except the thumbs of both the hands are placed within the loop and the floss is held tightly by both hands, having about 1 to 2 inches of floss between fingers of both the hands. Then gently guide the floss between the teeth using back and forth motion. Inside the contact, I curve the floss around the tooth in a C shape and move it up and down along the tooth surface from gingival margin upward. Continue this process around all teeth.
Mouthwash. So mouthwash is a liquid oral hygiene agent. It is used to control plaque and gingivitis. So most commonly used mouthwash is chlorhexidine gluconate, 0.2% concentration. So it is used to rinse the mouth for 30 seconds to 1 minute. It is used twice daily. So after that we have to spit it. So other most commonly used mouthwashes include essential oil rinse, povidone iodine mouthwash, fluoride mouthwash.